Most people don't think much about their kidneys. These two small organs quietly work inside our body every day, cleaning our blood and removing waste and extra water. But when something goes wrong with them, it can become very serious very quickly. Kidney cancer is one of those health problems that often doesn't show clear signs at first. This is why it's sometimes called a silent killer. By the time someone realizes something is wrong, the disease might already be at a dangerous stage. That's why knowing the early signs and paying attention to your body is so important. Your body often tries to warn you before things get worse. In this video, we're going to talk about 10 early signs of kidney cancer that people often ignore. These signs may seem small or unimportant, but they can save your life if you notice them early. Let's look at these silent signs, understand why they happen, and learn how to respond if we ever notice them. Number 1. Blood in urine. This may sound scary, but many people see it and don't take it seriously. Sometimes the blood is bright red, but often it's very light, or makes the urine look a little rusty or pink. It can appear one day and disappear the next, making it easy to forget. Many people assume it's due to an infection or something simple like a bladder issue. However, even a small amount of blood in your urine is worth checking. It's better to get it looked at early than to wait and find out later that something serious was happening. Number 2. A lump or swelling in your side or belly. Kidney tumors often grow deep in the body. They're hard to notice early, but if the tumor gets big, it might create a swelling or bump you can feel or see. People who are very slim might notice it earlier. If you ever feel something unusual in your side or belly area, it's a good idea to get it checked by a doctor. Number 3. Pain in the lower back or side. A steady pain in your lower back or side that doesn't go away can also be a warning sign. Most of us have back pain at some point, and we usually blame it on bad posture, a long day at work, or sleeping the wrong way. But if the pain stays for weeks and doesn't get better with rest, it could be something more serious. In kidney cancer, the pain usually happens because the tumor is growing and pressing on nearby tissues or nerves. Unlike muscle pain, this kind doesn't change when you move your body around. Number 4. Unexplained weight loss. When cancer is growing in your body, it uses up energy and changes how your body burns food. You might start losing weight even if you're eating the same and doing your normal activities. This is something people often miss, thinking the weight loss is a result of eating better or being more active. But if your weight drops and you don't know why, especially if it happens fast, talk to your doctor. Sudden weight loss can also weaken your immune system and make you feel more tired than usual. Paying attention to unplanned weight changes can help catch serious issues early. Number 5. Feeling tired all the time. We all feel tired now and then, especially after long days, poor sleep, or stress. But this kind of tiredness is different. It doesn't go away with sleep, and it feels heavy and constant. Cancer-related tiredness may also be linked to anemia, which is when your body doesn't have enough red blood cells. The kidneys play a role in making a hormone that helps your body create these cells. When the kidneys don't work properly, you may not have enough energy even for simple tasks. If you're always tired for no clear reason, it could be your body's way of asking for help. Long-term tiredness is not something to ignore. Number 6. Loss of appetite. If you stop feeling hungry for a long time, something may be wrong. A kidney that isn't working well may allow waste to build up in your blood, which can make you feel sick or full. This may also cause nausea. A short-term appetite loss isn't a big worry, but if you don't feel like eating for weeks, get it checked. Ongoing appetite loss can lead to weakness, weight loss, and vitamin deficiencies. It's important to notice these small changes before they turn into bigger health problems. Number 7. Long-lasting low fever. A slight fever that keeps coming back might be a sign your body is reacting to something inside, like cancer. Kidney cancer can cause fevers because the kidneys help control body temperature. Most of us treat a small fever with some rest or medicine and move on. But when a fever keeps coming back with no clear cause, it's worth mentioning to your doctor. Number 8. High blood pressure. High blood pressure is common, but sometimes it can be a sign of kidney trouble. The kidneys help control blood pressure by removing extra fluid from the body and managing certain hormones. If a tumor gets in the way, your blood pressure may rise. Many people don't know they have high blood pressure, so regular checkups are important, even if you feel fine. Number 9. Low red blood cell count, anemia. When your red blood cells are low, you may feel weak, cold, out of breath, or have pale skin. This can happen when kidney cancer causes slow bleeding, or when the kidney can't make a hormone that helps create red blood cells. It might also stop the body from using iron well. Many other things cause low red blood cells, but if it lasts without a reason, your doctor may check your kidney functions. Number 10. High calcium levels in the blood. Though rare, kidney cancer can raise the amount of calcium in your blood. You won't notice this just by how you feel, but it can still be dangerous. If your calcium is too high, you may feel more thirsty, pee more often, get constipated, or feel confused and weak. This problem often shows up in blood tests, which is another reason why regular checkups matter, especially if you're at higher risk. Some people are more likely to develop kidney cancer than others. If you smoke, are overweight, have high blood pressure, or have a family history of kidney cancer, your risk is higher. People with certain genetic conditions or those who have been on dialysis for many years also need to be extra careful. Exposure to harmful chemicals like cadmium or asbestos can also raise your risk. Knowing your risk factors helps you stay alert for early signs. If you start noticing any of the signs we've talked about, especially if they last for several weeks, it's a smart idea to see your doctor. Finding kidney cancer early makes a huge difference in treatment and recovery. Doctors may start with a physical exam, ask questions about your symptoms, and run some blood and urine tests. If needed, they might use scans like CT, MRI, or ultrasound to look more closely. Sometimes, they may take a small sample of tissue to see if it's cancer. The good news is that there are ways to reduce your risk. You can avoid tobacco, keep a healthy weight, eat balanced meals, exercise regularly, and manage your blood pressure and blood sugar. Don't use too many painkillers unless your doctor says it's okay. Even if you are diagnosed with kidney cancer, don't lose hope. Treatments have improved a lot in recent years. Surgery is still common, but now doctors also use special drugs, immune treatments, and other methods like freezing or heating the tumor. These options can help you live longer and healthier. If you found this video helpful and learned something new, give it a like and subscribe for more videos. Stay safe, take care of your body, and never ignore what it's trying to tell you.